Hey, I'm Dr. Matt McCarthy, and I'm a pediatric sports neurologist at Summit Medical Group in Florham Park. This June is National Migraine and Headache Awareness Month, and today I'm going to be talking a little bit about migraines. The goal of this awareness campaign is to encourage people who are having headaches and migraines to go and see a healthcare provider to ensure you have a proper diagnosis and make sure you're getting the best treatment for your headaches. Headache is a really common problem. About half of people will report getting headaches each year, and about 90% of people will report headaches at some point in their lifetime. There are a lot of different types of headaches, and migraine is one of the most common forms. More than 10% of people will be diagnosed with migraine, and that probably underestimates the actual number of people who are getting migraines. We know that many people will never be formally diagnosed for their migraines, and many people's migraines are untreated or undertreated. When people think about migraine, usually what comes to mind is a specific headache type, and that's part of it, but migraine's an overall brain sensitivity too. So people with migraine are more sensitive to headaches in general, but also sensitive to other things like motion sickness, cold headaches and brain freeze, and even strong smells. Migraine tends to run in families, and most people will start at some point during childhood and adolescence, but it varies over the course of their life. So what does a migraine feel like? What do people describe when they're having a migraine? While many people will start getting their migraines when they're in childhood or adolescence, the initial presentation of those migraines sometimes doesn't have all the classic characteristics we expect from migraine, and sometimes it takes a little time for that to evolve. But in general, a migraine headache tends to be a long-lasting headache. It can last several hours or even days. Most people describe the quality of the pain as a pulsing or a throbbing feeling, and it can occur in any part of the head, but often is one-sided, although it can occur on both sides together. The severity of that pain is usually moderate to severe. People tend to find it difficult to do their usual activities, and it usually prevents people from functioning during the day when they're having the migraine. There are a lot of associated symptoms you can have with a migraine that can include light sensitivity, sound sensitivity, nausea, and even vomiting. There are multiple different variants of migraine that will have slightly different presentations from that classic migraine. And one of the most common is migraine with aura. And aura is a neurologic symptom that occurs before or at the same time as a migraine headache. There are a bunch of different types of auras, but the most common tend to be visual and sensory. Common visual auras are seeing things like lights, patterns, colors. And common sensory auras can be feelings of tingling and numbness. One important thing about migraine is it's something that is really responsive to treatments. There are a lot of different treatments for migraine, and there's always new treatments coming out. There are really two types of treatment for migraines. One is preventative treatments. Those are things you're doing that are trying to reduce the frequency of migraine attacks or prevent them from coming. And the second is abortive treatments. Abortive treatments are things you do to try to stop, reduce the severity, or shorten the duration of a migraine attack once it's started. Anybody with migraine should have a plan for both a preventative and an abortive treatment. And there's a ton of different options. That can range from things like lifestyle changes, identifying triggers and avoiding them, habit changes, nutritional changes, vitamins, supplements, over-the-counter medicines. There are prescription medicines. There are things like injections and nerve blocks that can help. There are new antibody therapies. And there's other types of therapies, including physical therapy and behavioral therapy, where there's good evidence it can help people with migraines. Migraines are not something that's dangerous or harmful to have. People with migraine have a normal life expectancy, but having migraines can cause significant functional impairment. It can cause a significant decline in quality of life. So it's important that anybody who's having headaches and who's suffering with migraines should be seen by somebody in order to try to come up with a good, comprehensive, individualized treatment plan that includes both prevention and abortive strategies. And it's also important to have a multidisciplinary team. Here at Summit Medical Group, our neuroscience department has a multidisciplinary approach to treating patients with migraine and treating patients with headaches. And our team includes adult and pediatric neurologists, interventional pain management specialists, physical therapists, and behavioral therapists.